All right, looking here at the feedback system components, you can see that there are three physical components. I like to think of it in terms of five, though, and I'll tell you why. The receptor is what's detecting the stimulus, the deviation from the set point. The control center then hears from the receptor and decides if we should do something about it. And then if it decides to turn on the mechanism, the effector is the thing that can change the value of the variable. And then, of course, the response is what is produced by the effector. So let's think about body temperature again. If it's 100 degrees outside, the ambient temperature is the stimulus that causes my body temperature to go up. The receptor are these thermoreceptors in my brain and blood vessels. And then the control center is a region of the brain called the hypothalamus, which is then going to send a signal to the sweat glands, which are the effector, and then perspiring and evaporation, which cools me off, is the response produced by the effector. So if we look at the next slide, you can see some other examples. Blood pressure. If blood pressure is too high, it sends a signal to the brain stem, the control center, to cause the heart to slow down, and that can decrease our blood pressure. So heart rate, or rather homeostasis, maintaining that stable heart rate, is the result of a negative feedback system. There are some very helpful flow charts in your textbook that can walk you through those different components. So you should be prepared on quiz or test day to tell me something about feedback systems and the difference between a positive and a negative feedback system, and some specific examples of each of those. We can see here that positive feedback is constantly increasing the value outside of the normal range. So again, in childbirth, as the lady is feeling those contractions, they're just going to get more frequent and more intense, up and up and up and up, away from that set point, so that we can resolve the issue. Going back to a little bit more detail on some of these directional terms, you can see I'm now on slide number 22, reviewing the anatomical position. You might pause the video right here just to practice using these terms and talking about one body part relative to another one. For example, your earlobe is lateral to your nostril, or your belly button is medial to your hip bone. A couple of other directional terms we didn't talk about too much are these ones right here, superficial and deep. Superficial means towards the surface, and deep means away from the surface. So if you look at your hand, you can see the skin is superficial, but if you move your fingers, you might see the tendons moving underneath the skin. The tendons are deep to the skin. And then deeper yet, we might find metacarpals, hand bones, right? So we would say that the tendons are superficial to the hand bones, but that the skin is superficial to the tendon. Table 1.1 does a nice job of summarizing specific examples and helps you understand these terms that you're responsible for knowing. If those terms are the north and south directional terms, these ones are the states. This is Alaska, this is Kansas, here's Hawaii, right? These are the body parts and regions. A lot of this is Latin, and so for those of you who speak Spanish or Italian, you might recognize some of these. For those of you who don't speak Greek or Latin, you have a lot of studying to do. The good news is you're going to start to recognize some of these things. So let's go through these. Frontal, orbital, nasal, oral. Cervical. Have to be careful with this one because not only does it mean the neck bone, but it can mean pertaining to the cervix, right? A part of the female reproductive system. Pectoral can be pronounced pectoral, sternal, mammary, abdominal, umbilical, pelvic, inguinal, pubic, otic, buccal, mental, clavicular, axillary, brachial, antecubital, antebrachial, carpal, palmar, digital, coxal, femoral or femoral, patellar, crural. The talus is the ankle. It's specifically a bone that we'll learn about right down here in the ankle. And then the dorsum is the top of the foot, and the plantar surface is the bottom of the foot. A great way to study these terms, by the way, is to print off this image or something like it and cut apart the labels and then place them so that it's a nice interactive way. If you just look at it and memorize it, sometimes it doesn't stick quite as well as if you're actually manipulating or moving your body or moving the notes. Here we see a posterior perspective. Notice that the patient is still in the anatomical position. Occipital, that's the base of the skull. Nuchal, scapular, vertebral or vertebral, lumbar, sacral, gluteal or gluteal, perineal. Perineal actually refers to the region between the anus and the genitalia, so we can't quite see it in this perspective, but it is a good term to know. Cranial, acromial, the olecranon, the point of the elbow, the dorsum, back of the hand, just like the dorsal surface is the posterior part of the body. Popliteal, some people say popliteal, sural, and then calcaneal is this called Achilles tendon, so-called Achilles tendon. We're not in a Greek mythology class. This is an A&P class, and so we call it the calcaneal region and the calcaneal tendon. Next, we can look at the abdominal subdivisions. These terms are really used when we're doing a surface exam. I'm not sure these terms would really be appropriate when we're looking at three-dimensional images, but if a patient comes in and they have abdominal pain in a certain region, by knowing where that region is, you can chart or pass the information on to the next provider. So on the left side of the screen, you can see the right upper quadrant, left upper quadrant, right and left lower quadrant. Those are pretty easy. The one on the right side gives us 9 quadrants, and it's a bit more complicated. Starting in the center, we can see the umbilical region. And then above and below are the epigastric and hypogastric regions. Epi means above or superficial to, like an epidural. And gastric means the stomach. So above or superficial to the stomach. Down here, sort of where the urinary bladder and many of our small intestines are found here in the hypogastric region. Right and left lumbar region refers to the large vertebral segment, the lumbar spine. And then right up here, hypochondriac. You might be surprised that word we sometimes use to talk about a symptom magnifier. And I guess it's because people used to walk into the doctor with their hand underneath their ribs. Oh my gosh, it hurts so bad. So hypochondriac really means below the cartilage. Right hypochondriac, left hypochondriac. Ilium is the hip bone we'll be learning about soon when we study the skeleton. And so we have the left and right iliac regions. One quick thing, you probably noticed that the right and left are switched. It's because the patient is always right. This is the patient's right side, even though it appears on your left field of view. So that's very important when you're charting to use the correct right or left side. When we look at imaging in particular, like MRIs or CT scans, or when we're looking at anatomical sketches, sometimes we need to divide the body by these planes. Plane as in a geometric plane, right? Not an airplane. So we see the mid-sagittal or median plane divides the body right down the center. Although you can have a sagittal plane that's not in the midline if you just shift it a little bit. So imagine, or maybe you could play along if you hold up a piece of paper right now and hold the paper so that it's parallel to the wall next to you, running up and down parallel to the wall next to you, and then move that from the center, which would be a mid-sagittal, so that it's cutting your eyeball right down the center. That would be a sagittal plane through the eye, but not a mid-sagittal plane, because the mid-sagittal is right in the midline of the body. Okay, now look at this one here. Look at this plane cutting this man into front and back, right? Cutting him into anterior and posterior sections. This is the frontal plane, sometimes called the coronal plane. Then we have the transverse or horizontal plane. So we know we live in a three-dimensional world, and so we have these three planes that run relative to the anatomical position. Although we don't see it here, you could have a slanting or angled so-called oblique plane, and you might want to do that if you were ordering a special CT or MRI, trying to view maybe abnormal anatomy. The challenge, of course, is when we cut through an organ or body with one of these planes, then we're going to see a picture. And we have to try to visualize where that picture was in the three-dimensional structure. So, for example, this longitudinal section is going to cut through the small intestine and give us this big long oval. But if we did a transverse or an oblique section, we're going to get either a perfect circle or maybe an oval. Those of you going into radiology or physical medicine, those of you who are going to do a lot of imaging or reading of images, you can really improve your visuospatial skills by practicing that. All right, stay tuned. I'm going to continue the video in our next podcast.